Hi everyone, I'm Karen Woodall. I'm a forensic toxicologist. I'm an assistant professor at the University of Toronto, the Mississauga campus in the forensic science program. And before I joined there a couple of years ago, I worked for 20 years at the Centre of Forensic Sciences in Toronto, and again as a forensic toxicologist there. So today, my presentation is going to be about the opioid crisis and the challenges that's created and is still happening for forensic toxicologists. So I'm going to start just with a brief history and overview about opioids. So opioids are a group of drugs that bind to opioid receptors in the body. They first came from natural plants, the opium poppy, and in the 1800s, morphine was first extracted from the opium poppy. And in fact, it was a major milestone in pharmacology. And it was the first time an active ingredient of a medicinal plant was isolated. Morphine itself is named after the Roman god of dreams, Morpheus, and that's due to some of the sedating properties of opioid drugs. So opioids, as I'm sure you're all aware, they're used therapeutically to relieve pain, so they can be very good analgesic drugs. But as we also know that there can be some serious issues with opioid use, and that is mainly due to the high potential for abuse. So some people that take opioids can get a strong euphoric effect, so it leads to abuse and unfortunately overdoses and deaths. Another important point about opioids is that chronic use of opioids can lead to tolerance, which means you can take more of a drug without suffering from some of the effects of the drug. In terms of toxicology, this can be important because if you're tolerant to opioids, it means you can take more of an opioid drug before suffering from some of the adverse effects. There's a few different types of opioids. So one type is the naturally occurring opioids. So these are the ones that come from the opium poppy. Some examples of those are morphine and codeine. Another type of opioids are called semi-synthetic opioids, and they have a structure that is related to the naturally occurring opioids, but they're altered slightly. And a few examples of those would be hydromorphone and oxycodone. Another group of opioid drugs are known as synthetic opioids, and the chemical structure of synthetic opioids is not similar at all to the naturally occurring opioids, yet they still act on opioid receptors in the body. So chemically, they're a very diverse group of drugs, but they have the same effects on the opioid receptors. So in terms of opioids, how strong are they? And this is something that's important for people taking opioids, people prescribing opioids. And different opioids will have different strengths. An example would be codeine, which it's a mild opioid drug, and that might be prescribed for more minor issues, such as if you have minor dental work, you might get a prescription for codeine. Fentanyl, on the other hand, is an extremely powerful opioid, and it's only going to be prescribed for people with chronic pain conditions in patients already tolerant to opioids. You can get charts showing potency of opioids, and they're used by medical personnel when they're prescribing to avoid potentially fatal dosing errors. This is an example of the type of chart that could be used. So the opioid that other opioids are compared to is morphine. So morphine has a value of 1 in terms of potency or strength. So codeine, as I mentioned, which is kind of a mild opioid, that has 1/10 as strong as morphine. Oxycodone is just a little bit stronger than morphine. heroin is 5 times stronger than morphine, and then fentanyl is 100 times stronger than morphine. So you can see just based on this potency chart that fentanyl is an extremely strong opioid drug. And that becomes important when we talk about the opioid crisis. Which brings me to, well, what is the opioid crisis? The opioid crisis has been described as a major health concern and issue in North America, and it's also affected many other countries around the world. In North America, 3 waves have been identified. So the first wave began in the 1990s, and it was related to the increase in prescription opioid use. The second wave was related to a slight shift away from prescription opioid use to an increase in the use of illicit heroin. So that was in the sort of early 2000s. And then from about 2013, the third wave, which has led to a dramatic increase in the number of opioid deaths, is mainly due to synthetic opioids. So fentanyl is the main one in this category, but there's other newer drugs. Some are fentanyl analogues that are also detected in this third wave. So why is the opioid crisis such a problem? Well, it's a public health concern. As I mentioned, there's been a dramatic increase in the number of hospitalizations and the number of deaths due to opioid use. And then for toxicology laboratories and toxicologists, it's created an issue in terms of resources because it's increased the number of casework, the number of samples that need to be tested for the presence of opioids. And then in the third wave and an increase in some newer opioids, there's a lack of information about some of the types of opioids that are being used, and that creates issues too. So just talking about some of the public health issues, this is data from Ontario Public Health. They have an online opioid tracker. So Ontario is a province in Canada. And this shows the number of opioids present at death. This graph goes from 2003 to 2019. And if you look at the graph, you can see the blue line, which is fentanyl or fentanyl-related drugs. In the early 2000s, there were probably less than 5 fentanyl-related deaths each year. But this graph, from around 2014, we started to see a significant increase in the number of fentanyl-related deaths. And you could see the last few years, so 2017 and on, like a really huge number of fentanyl-related deaths in the province of Ontario. So it goes from being less than approximately 5 deaths a year in the early 2000s to now well over 1,000 deaths per year. The latest this data available is 2019, but other information has showed that this increase is still continuing to this day. It's a similar trend in the US. In fact, in the US, since the first wave of the opioid crisis hit, there's been over 500,000 opioid-related deaths. So you could see why it's considered such a significant public health concern. In 2019, data from the CDC shows that around 73% of all opioid-related deaths were due to synthetic opioids, and these were mainly fentanyl and fentanyl-related drugs. And in that year, 2019, there were over 36,000 deaths involving those types of drugs in the United States. Interestingly too, the source of fentanyl is more likely to be illicitly manufactured rather than pharmaceutical fentanyl. And that was one of the big shifts that occurred with the third wave of the opioid crisis, it's this illicitly manufactured fentanyl and other newer opioid drugs. Recently, with the current COVID-19 pandemic, the opioid crisis is still a significant concern. And in fact, the number of opioid-related deaths in North America has increased since the pandemic. This study was published in November, again from the province of Ontario, and it was looking at patterns surrounding opioid-related deaths during the pandemic. The preliminary data showed that during the first 15 weeks of the pandemic, there was a 38% increase in opioid-related deaths compared to the time period just before the province went into like social distancing measures and lockdown provisions. Some trends that were noticed in this study were that a lot of individuals were using drugs alone. A lot of deaths were occurring outdoors, in hotels and motels. And it was thought that there's a possibility that the increase in deaths is due to, well, partly due to reduced access to assistance during the pandemic. And that could contribute because people have less access to treatment, reduced support networks. If they're socially isolated and taking drugs alone, and they suffer an overdose, somebody might not be available to give them naloxone, for example. So the opioid crisis is still continuing, and the current COVID-19 pandemic appears to have made things worse. So because fentanyl has created such an issue for this opioid crisis, I'm just going to briefly give an overview about fentanyl. So I mentioned earlier in the presentation that fentanyl is a synthetic opioid, so it's fast-acting. It's used a lot in hospitals, so it can be used clinically to pre-medicate prior to surgery. It's available via prescription in the form of pain patches, so you can wear it on your skin for up to 3 days and get constant pain relief. If you're given it in hospital, then it tends to be in an injectable liquid form. Illicit fentanyl is often sold in the form of a powder. And some of the issues that you can get with illicit fentanyl is that people don't always know that it's fentanyl that they're getting. So sometimes they might buy something and they think it's heroin. Sometimes they might buy something that they think it's cocaine. And because fentanyl is such a powerful opioid, they don't have the tolerance to fentanyl, so it can cause accidental overdoses because people are not aware of what they're getting. In addition to fentanyl, there's a number of fentanyl analogues. Fentanyl analogues are chemically related to fentanyl, but they are slightly modified. And then another issue in the opioid crisis is counterfeit pharmaceuticals. These are tablets that are made to look like a proper pharmaceutical tablet. However, they contain illicitly manufactured drugs. The picture on this slide is a picture of a counterfeit OxyContin tablets. So they're green OxyContin 80 tablets, but they actually contain fentanyl. And again, if people are buying what they think is oxycodone, but it has fentanyl, they end up with a much stronger opioid. And there's been a lot of overdose deaths associated with people consuming these fake pharmaceutical products. So novel psychoactive substances are a group of drugs that legally mimic the effects of traditional drugs of abuse. So for example, hallucinogens, stimulants, cannabinoids, or opioids, and they're not internationally controlled. So they're designed so people can buy these substances and they're legally able to do it. And in the field of forensic toxicology, there's been like a proliferation of these novel psychoactive substances, and it creates a lot of challenges for forensic toxicologists. So some of the challenges, for example, forensic toxicologists are going to be some of the frontline people to help identify some of these emerging NPS trends. It's really important for toxicology labs to be able to collaborate with law enforcement, coroners, medical examiners, and public health officials. And some of the things that forensic toxicologists have to do is to have the ability to identify these drugs, hopefully to be able to quantify the drugs, and then help interpret the drug findings. Because if they're a new compound, not only do you have to be able to identify it, but you've got to be able to tell people, well, is this a significant amount? Is it a toxic amount? Is it even a potentially fatal amount? And that can be hard to do. In terms of kind of being on the front line and helping public health, for example, if it's a novel psychoactive substance that's a new opioid, if a lab is able to add a new opioid to an analytical method, it's going to help provide important surveillance information for public health agencies. Sometimes timely data collection in an outbreak can have a significant impact in supporting public policy or allowing points of intervention to be identified. And sometimes with some of these opioid drugs, you might get an outbreak. So for example, in one particular location, there's a bad batch of drugs that contains a very strong opioid or a new opioid that nobody's seen before. And if a forensic lab can help identify the drugs and alert public health, they can give out warnings to people in the drug community, and they could at least be aware that there's an issue with some of the supply of drugs. A lot of areas, they have naloxone kits available, but if people know that there's an issue with the drug supply, it might encourage them to have these additional kind of intervention ready to go if there's issues. So with the appearance of some of these novel psychoactive substances, and in particular the opioids, in terms of the opioid crisis, some of the challenges are that compounds can appear and disappear very rapidly. So a new drug might appear 1 month, and then 2 or 3 months later, it might be gone from the market. So laboratories need to be able to adapt quickly. For many forensic toxicology laboratories with limited resources, this can be a real issue. So some forensic labs, they're publicly funded, they're able to do kind of routine testing and they can do it quite well. But if you get new drugs that need to be tested, you might have to decide, well, where are we going to put our resources? Which drugs are going to be more prevalent? And also which drugs are going to be more toxic? Should we focus on those first? An example of that would be the first appearance of carfentanil. So in Canada, it first appeared on the drug scene in around 2016, and that was similar to the United States. Now, carfentanil is related to fentanyl, so it's a fentanyl analog. It's approved for use in large animals, but it has no approved use in humans. And in terms of potency, carfentanil is 100 times stronger than fentanyl, and it's 10,000 times stronger than morphine. So you can see, just looking at the strength of carfentanil, how it could be a real issue if people are starting to take drugs that contain carfentanil. So for forensic labs, it created analytical challenges because carfentanil appears in the drug supply, and a lab needs to be able to adapt to that and be able to test biological samples to see if carfentanil is present, and if so, how much is present. So you need to be able to establish a sensitive method so you can quantitate carfentanil. And when it's a drug such as carfentanil that is so potent, you need to have a method that's capable of detecting very, very low concentrations. And that can be a challenge, and it can take time to set up a method so you can see that. Also, even just something as simple as obtaining analytical standards for method development can be difficult. There's a lot of restrictions on being able to get carfentanil standards that you need to develop a method. So sometimes it can take months just to get the legal ability to buy carfentanil standards for the laboratory to be able to develop these methods. And when it takes months to develop these methods, but people are still kind of dying of overdoses, that creates a real challenge for a toxicology lab, because you want to be able to keep up to date and be able to assist investigators in what drugs are currently being used. Another example of this is the novel psychoactive opioid U47700. Now, similar to carfentanil, this first appeared in Canada and again similar in the United States in around 2016. This drug, the users of this drug report that it's more euphoric than fentanyl. So some of the drug using communities, they like this drug. It was going to be a popular drug. Even though we call it a novel psychoactive substance, it was actually first developed in 1978 by a pharmaceutical company, but it never actually progressed and was used in humans. So it first appeared, so in Canada, for example, I think it was approximately 5 deaths were first reported in 2016, early 2017. And then there was a change in the legal status and it became a Schedule I controlled substance. And this change in the legal status meant that the popularity of U47700 just immediately dropped. And actually, users then switched to a similar drug, U49900. It's an analog of U47700, so it's structurally similar, but this wasn't made by a pharmaceutical company, so there was absolutely no published literature about this drug. So it was a brand new chemical. So toxicology labs had to develop methods for the detection of this drug. There's no information available about toxic concentrations, potentially fatal concentrations. And it's an example of how things change very, very quickly just because of a scheduling change. So in Canada and in the United States, when both the governments set legal restrictions on U47700, the drug community immediately switched to another chemical. So it's that playing catch up that forensic toxicology labs have to do. So how do forensic toxicology labs can monitor these drug trends that are going on? Because you can get trends in countries, but even within countries in different regional areas, one drug might be popular for a few months and then change, and then in a different area, a different drug might become popular. So again, it's that forensic labs have to adapt to all these changes. So it's very important for labs to try to monitor what's going on. So how do forensic toxicologists do that? Well, drug seizures can be a great source of information. So sometimes drugs are seized at the border. They can get tested. Police investigations, maybe if they seize drugs in a drug trafficking investigation, if that drug is tested, the information from those drug seizures provides information about what's currently out on the streets. Another way is testing in forensic laboratories or testing in clinical laboratories. Sometimes if labs identify a new drug, they will publish the method. They'll alert the community and say, hey, this is a new compound that we've just found in this area. A good way of keeping up to date with information is the Society of Forensic Toxicologists. So their website has information on a lot of the new novel psychoactive opioids and other drugs too. Published case reports can be a good way of getting information, although by the time a case report is published, it can be, at least 2 or 3 months out of date. And because the drug trends change so quickly, it might already be out of date, but it's still good to know kind of what's out there. So for example, a published case report might be a couple of deaths that have occurred due to some novel opioid that's appeared. And then an additional source of information is actually some of the websites that drug users use. So they will post information about drugs, what they're currently using, what the effects are. They'll compare the strength of the drugs to other drugs that are already on the market. Some examples of that would be Erowid, Reddit, or a website called Psychonaut Wiki. So forensic toxicologists sometimes find it useful to monitor some of these drug user websites because it does provide some good information. Some other useful resources that are really good is in the United States, the Drug Enforcement Administration and the National Forensic Laboratory Information System, they both provide information on drugs that are detected in drug testing labs and forensic laboratories all across the United States. And that information is available on their website. So it's a great way of keeping up to date with what drugs are currently being seen. And then in Europe, they have a European Monitoring Center for Drugs and Drug Addiction, and they have a really good early warning system on new psychoactive substances. So they'll provide information about what drugs that are currently being seen in Europe, what some of the effects of the drugs are, like if there's any deaths being reported. So again, it provides a lot of useful information. And it's really important for forensic toxicologists to try and keep up to date with some of the changes that are occurring because there's so many challenges with being able to keep up with what's being used out in the real world. Okay, so thank you for listening. I provided the overview about challenges for forensic toxicologists in relation to the opioid crisis. And if you have any follow-up questions, please feel free to email me. My email address is karen.woodall@utoronto.ca. So thanks very much.